Good morning. Welcome to part 6 of nursing practice questions and answers about risk conditions related to pregnancy. Now let's start with the first question. The nurse is planning to admit a pregnant client who is obese. In planning care for this client, which potential client needs would the nurse anticipate? So select all that apply. So these are the options. Option A, bed rest as a necessary preventive measure may be prescribed. Option B, administration of subcutaneous heparin post-delivery as prescribed. Option C, an overbed lift may be necessary if the client requires a cesarean section. Option D, less frequent cleansing of a cesarean incision, if present, may be prescribed. Option E, thromboembolism, stockings, or sequential compression device may be prescribed. Now for this question, the correct answer is options B, administration of subcutaneous heparin post-delivery as prescribed. Then option C, an overbed lift may be necessary if the client requires a cesarean section. And option E, thromboembolism stockings or sequential compression devices may be prescribed. Now let's move to the rationale. The obese pregnant client is at risk for complications such as venous thromboembolism and increased need for cesarean section. Additionally, the obese client requires special considerations pertaining to nursing care. To prevent venous thromboembolism, particularly in the client who requires cesarean section, frequent and early ambulation prior to and after surgery is recommended. Also, routine administration of prophylactic pharmacological venous thromboembolism medications such as heparin is also commonly prescribed. An overbed lift may be needed to transfer a client from an operating table to bed if cesarean section is necessary. Increasing monitoring and cleansing of a cesarean incision, if present, is necessary due to the increased risk for infection secondary to increased abdominal fat. Finally, thromboembolism stockings or sequential compression devices will likely be prescribed because of the client's increased risk of blood clots. Now let's move to the second question. The nurse is assessing a pregnant client in the second trimester of pregnancy who was admitted to the maternity unit with a suspected diagnosis of abruptio placentae. Which assessment finding would the nurse expect to note if this condition is present? So these are the options. Option A, soft abdomen. Option B, uterine tenderness. Option C, absence of abdominal pain. Option D, painless, bright red vaginal bleeding. So for this question, the correct answer is option B, uterine tenderness. Now let's move to the rationale. Abruptio placentae is the premature separation of the placenta from the uterine wall after the 20th week of gestation. In abruptio placentae, acute abdominal pain is present. Uterine tenderness accompanies placental abruption, especially with a central abruption and trapped blood behind the placenta. The abdomen feels hard and border-like on palpation as the blood penetrates the myometrium and causes uterine irritability. A soft abdomen and painless, bright red vaginal bleeding in the second or third trimester of pregnancy are signs of placenta previa. Now, in my presentation, my reference book have used Saunders Comprehensive Review for the NCLEX RN Examination 9th edition.